And your last point on the board was dose response. Did you find some studies that talk about dose response?
Yes, I did.
Which ones?
I want to go kind of mention those in a special order, if you could please allow me a minute. Wu is one of them. Since we're just at Wu, might as well be there. Wu is one of those because it mentioned the frequency and duration. And then the dose response is part of the dosing is the duration. The longer years you've used something, the higher dose you've been exposed to. So that's one of the elements. Wu was one of those. The other one was the Kramer 99 I just cited. The Kramer 82 I just cited. And also the Terry Pooled study from 2013.
And why is that important to you?
You mean the dose response?
Yes.
Because it's an element to consider when I would like to evaluate for association between the presence of a risk factor and a disease or a condition under study. The longer they've used it, the more they've used the like they've used it more frequently every day for many more years, and it's increasing the risk of developing the ovarian cancer or whatever condition I'm studying.
So after doing your differential diagnosis, looking at the evidence that you've shared with the jury, and based on your differential diagnosis, what are your opinions on whether or not talc caused Mrs. Echeveria's ovarian cancer?
As I mentioned earlier, I looked at the risk factors, the protective factors, ruling in and ruling out those, then evaluated her own exposure to talc, the fact that talc was found in the ovarian cancer tissue of hers, of our patient, the biologically plausible mechanism of migration. And
you're not getting specific on the
no, I'm
mechanism. You're being just generally, right?
Correct.
Okay, go ahead.
Correct. A biologically plausible general mechanism of migration, inflammation, and how talc can migrate, how it can cause inflammation, and how inflammation can cause cancerous transformation through very well-established pathways, from that oxidative stress, the cytokines, and in answering your question, the conclusion would be is that talc was more probable than not the causing agent in Ms. Echeveria's developing high-grade serous ovarian cancer.
Do you have an opinion as to it's more probable than not that but for Mrs. Echeveria's use of talc, that she would not have developed her serous epithelial ovarian cancer?
Correct.
Your answer is she would not have developed it.
Correct.
Your Honor, I have nothing further. Hold on. Alan's got something. Okay. Moving on, the same question. When you say more probable or not, do you mean greater than 50%?
Yes, I do.